We're going to go over a checklist for teaching you how to infuse your antibiotics at home. You may need a caregiver or a friend to hook up your antibiotics to the PICC line and to begin your infusions. Remember, this is a lot of information and we are here to support you throughout this. We encourage you to call the office during normal business hours so we can assist you. You're going to receive a troubleshooting worksheet that includes all this information. However, if there's an issue that cannot wait, you can contact the nurse on call. The nurse on call is able to contact Dr. Shaw if the need is urgent. If there is an emergency, such as difficulty breathing, then you need to go to the hospital or call 911. Come to the office once a week to get a new supply of antibiotics and get a PICC line dressing changed, and it's usually on Tuesday. However, the day may vary depending on your PICC. It is important to finish the course of your antibiotics. You also need to prevent infection with good hand washing before and after infusions. You need to be aware of how to spot an infection. This may include a fever, redness, swelling, heat, pus draining from the site, or anything abnormal. You need to have good hygiene with showering and bathing. You can wrap your PICC line with saran wrap or other materials that keep it from getting wet. However, do not remove your dressing. Just keep it covered when you shower. Properly covering the PICC line is important to keep it from getting wet. You need to know how often to get your antibiotic and what to do if you miss a dose. If you miss a dose or if something happens and the dose is wasted, you need to contact Dr. Shaw's office immediately so we can follow up on how to manage the missed dose. You need to know how to prime the tubing and get the bubbles out of the tubing before the infusion. We'll show you how to do this when you first come in, and you can also refer to our educational video. It's very important not to touch the spike, and also important to get the antibiotic connected to the PICC line in a clean fashion. You need to know that the flushing before and after is extremely important to make sure your PICC is able to be used. The heparin is after the saline, and it keeps your PICC from getting clotted. Now we're going to talk about troubleshooting for the PICC line. Oh, it's okay.